Hi, my name is Miranda, and today I will be talking about the implications of poor communication skills in the workplace. The learning targets that I will be touching base on in this presentation include what are poor communication skills and what are their implications? What are the aspects of good communication skills, and how does this impact our patients and colleagues? And finally, what are the models and techniques that can better our own communication skills? But firstly, let's address what is communication and why is it important? Well, according to Yunsen, communication is the study of the transfer of meanings. This can be through verbal communication, such as conversations with others, presentations, or public speaking, or nonverbal communication, which includes body language, such as kinesics, facial expressions, body posture, back channeling, and the ability to actively listen to a patient. Now, there is no doubt that communication is vital in all workplaces, including dermal clinics. Good communication skills, such as actively listening and maintaining good eye contact with the patient, allows the patient to feel validated and respected, therefore building more trust in their dermal consultants. This further builds patient rapport, which further enhances therapeutic relationships to occur. Furthermore, good communication skills strengthens the collaboration between a patient and a dermal practitioner. This promotes the patient-centered treatments based on their values and personal preferences. In addition to this, during a consultation, this can also reduce the amount of mistakes made, therefore leading to a better health outcome for the patient. Lastly, this can address misunderstandings a patient might have during the consultation. So it is important to interactively talk to a patient, listen to a patient, and address the concerns and queries they may have. Now, what are considered bad communication skills? Well, this includes a mixture of nonverbal forms of communication and verbal forms of communication, such as invalidating or ignoring a patient's concerns, which can result in a linear form of communication where a consultant is asking questions to a patient and a patient is just simply answering these questions without elaborating on their own concerns. Furthermore, a lack of eye contact, not actively engaging or listening to a patient, failure to empathize with a patient, showing disinterest, such as being distracted, looking at the computer, providing complex information without providing clarity, which causes the patient to be confused or unsure about a treatment plan, and poor body language, such as slouching, looking away, weird facial expressions. This is not an exhaustive list, and there are many other bad forms of communication skills. The impacts of these poor communication skills diminishes the trust and rapport between a patient and a dermal clinician. The inability of centering focus on the patient, the ability of maintaining good eye contact, and the failure of actively listening and engaging in a patient's concerns can result in a patient becoming more reluctant in disclosing their personal concerns and their personal goals. A patient can also inhibit feelings of distrust and stress as a result of feeling undervalued and unheard. These examples of poor communication diminishes a patient's trust and rapport in a dermal practitioner, further hindering the therapeutic relationship. Ineffective communication skills can cause misunderstandings to occur. The failure to communicate clinical information effectively through unclear instructions can cause patients to misunderstand or misinterpret the treatment strategy. For example, let's say during a consultation, a dermal practitioner recommended a laser hair removal treatment suited for the client. However, medical jargon was utilized, causing the client to leave the clinic confused and unsure of what to expect. This is something that dermal clinicians and dermal consultants should avoid when providing information to a patient. Misunderstandings can stem from a dermal practitioner using technical terms that a client does not understand, providing unclear treatment and aftercare instructions, which can cause a patient to be unaware of their actions talking at a quick pace, which makes it difficult for a patient to keep up, and documenting the incorrect treatment plan for a patient, which can cause legal issues to arise. Consequences of these misunderstandings between a dermal practitioner and a patient can cause legal issues if a dermal practice has been conducted incorrectly or causing patient dissatisfaction. It is important to note that the primary purpose of communication is to gather clinical data on the patient before, during, and after consultations and treatments. It is compulsory for healthcare workers to accurately, properly, and privately document these in the health record. If this is not conducted appropriately, this can cause fines for the dermal clinic or a loss of license for certain dermal practitioners. Dermal practitioners must communicate health information and treatment plans concisely with clarity. Why? Well, this is the case because patients will have a better understanding of this and can ask questions in regards to the treatment. And also, patients will not go into a treatment blindsided and will expect the outcomes and side effects that occur after a treatment. How can good communication skills be applied? This can be applied through the interactive model of communication, which is the two-way exchange between a patient and a healthcare practitioner of information. This allows practitioners to actively listen to the patient's concerns, provide information that is intelligible and clear, check their understanding of a treatment, and address queries patients may have. Good communication skills include listening to patients and deciphering their concerns and knowledge to find a suitable treatment plan tailored to them, actively engaging to a patient through back-channeling, maintaining focus on the patient instead of multitasking, such as looking at the computer and typing consultation information. This way, the patient will feel heard and valued, and maintaining good eye contact with the patient to show interest. Good communication skills involve practitioners in empathizing to understand a patient's needs, values, and goals after a treatment. Rapport and trust is built in enhancing therapeutic relationships between the patient and the dermal consultant. Furthermore, this ensures the safety of the patient in providing good health outcomes after a dermal treatment. In conclusion, the inability to communicate effectively to a patient may result in patients misunderstanding a therapeutic regimen or aftercare, therefore increasing the risk of poor health outcomes. This can cause the patient to inhibit feelings of fear, danger, and stress, further hindering their trust and rapport in a dermal practitioner. Furthermore, poor communication skills can cause miscommunication between a consultant and other dermal professionals responsible for inducing a practice, increasing the risk of harm. This repercussion can cause legal issues to arise. This is the reason why good communication skills are essential in any workplace, including a dermal clinic. Thank you for listening.